global public health experts, respected officials from the Ministry of Health, as well as representatives from international agencies and NGOs were attended in our Congress. Plenary sessions, roundtable discussions, and of course, presentations of epidemiologists gave us a new dimension of thinking and working together. Development of clinical management of a health system has enormous importance, but application of epidemiological methods in response to public health emergencies was our theme, has had an impact for years. Now, we humbly request our chairperson of the closing ceremony of the Congress, Professor Dr. TEPHINET, Director IEDCR Madam, to the dais to take her seat. And with her, I also requested Dr. Mustaq Hussain sir and Dr. M. Selimuzzaman sir to the dais. Mr. Muhammad Ali Noor, Honorable Secretary, Medical Education and Family Welfare Division, Ministry of Health and Family Welfare, Government of the People's Republic of Bangladesh, has honored us to be the chief guest of the joint event. He will join with us in online. He joined in online. And also Professor Dr. A.H.M. Inayat Hussain sir, Directorate General of Medical Education, DGME, make us proud to be the special guest of the closing ceremony. After 8 March 2020, IEDCR, FETP, all were busy with COVID-19 duties. In this pandemic situation, 24/7, they work on the field, they work for country, they work for mankind. We have no way of respect them in money or in salute them, but in this Congress we want to respect them through a crest of our respect. Now I requested the frontline fighters of COVID-19 to take crest from our guest from the dais. Now I call Dr. Prince to come at dais and take his crest of honor. Please, Dr. Prince. One by one, I will call your name and you will come to the dais and take the crest from our respected madam. Then Dr. Sayyada Tasnuba Maria. Please, Dr. Sayyada Tasnuba Maria. Dr. Sabrina Mohana. Then Dr. Alpona Mujumdar. I requested all of you to come to the dais one by one. Then Dr. Jinnatun Nabi, 6th cohort FETP B. Dr. Ashish Kumar Kundu. Dr. Jafrin Jahed Jiti. And next, Dr. Muhammad Farooq Ahmed. Dr. Muhammad Tawhidul Anwar. Please give a big hands for them, please. There is a leg. Dr. Shubroto Malakar, Dr. Jahidur Rahman. We know that we are at COVID situation. For that reason, you should maintain the social distancing when you came to the dais.
Now I'd call upon the FETP graduates from the 5th cohort, Dr. Farsim Tarannum Haq, Dr. Qazi Tahmina, Dr. Qazi Tahmina, Dr. Tonima Islam, Dr. Debashish Kumar Shaha, Dr. Muhammad Shahadat Hussain, Dr. Shahata Zarab Salehin, Dr. Shah Muhammad Mohibullah,
Now, I would request Dr. Muhammad Afzalur Rahman. Then Dr. Nusrat Sharmin Poppy. Dr. Muhammad Omar Kayum. Dr. Sohail Rahman. Dr. Farzana Khan. One of our graduate from 3rd cohort, Dr. Nauroz, she worked for COVID-19 from the first of the call, but Dr. Nauroz is at this moment COVID-19 positive. For that reason, he cannot attend this Congress. Now I call Dr. Mohammad Rashid. Dr. Mona Lisa. She's absent maybe. Dr. Mollik Masum Billah. Dr. Qazi Ahmed Jaki. He's also absent there. Now I request to collect the certificate of presentation, poster presentation of this Congress. Please come one after one and collect your certificate of presentation from Chairperson of the Congress. First of all, Professor Dr. Nasima Sultana, Dr. Mohammad Firdaus Rahman Sarkar, on behalf of Dr. Firdaus Rahman Sarkar, I requested Dr. Mohammad Omar Qayyum to collect this certificate and crest. Then Dr. Jinnatun Nabi. I requested Dr. Jinnatun Nabi. I request Dr. Jafrin Jahid Jiti. Dr. Muhammad Tauhidul Anwar. Poster presentation.
Dr. Mohammad Mohibullah Shourab. Dr. Mohammad Tauhidul Anwar. Dr. Mustafa Mahtab Toaha. Dr. Tonima Islam. Dr. Shirajul Islam. Dr. Muhammad Omar Qayyum. Dr. Ashish Kumar Kundu. Dr. Saida Tahmina Firdaus Jinia. Dr. Sohail Rahman. Dr. Geeta Rani Devi from CBSC. Dr. Samia Akhtar's crest certificate will be received by Dr. Omar Qayyum. Now we request Dr. Mollik Masum Billah, Senior Scientific Officer of Epidemiology Department of IEDCR, to give us a speech on his experience of COVID-19 and on the performance of the frontline.
So, thank you, Farjana. Honorable Chief Guest, our Chair and a special guest, It is our great opportunity that we get to participate in this conference and shares a lot of activities of FETP B course. And we are actually great we are for great pleasure that our secretary sir is online. So we want to give a short introduction of our FETP course to him. Then we'll start a small talk. So please, sir. Sound in.
Who has given their life to something bigger than oneself. A hero is a disease detective. Become a national leader in public health. Learn by doing. Lead outbreak investigations across Bangladesh. Challenge yourself to see health and medical care from a new perspective. Develop your scientific thinking skills. Join a family of FETP graduates from more than 80 countries. Interact and learn from global experts in public health. FETP B is an on-the-job, full-time fellowship focused on field-based applied epidemiology and general public health leadership. FETP B fellows evaluate and improve surveillance systems, develop health communication skills, and conduct public health field research on the most important health issues facing the country. FETP is modeled on the 50-year-old flagship CDC Atlanta program to train its core epidemiologists and public health leaders called the CDC's EIS program. In 2013, the Institute of Epidemiology, Disease Control and Research, IEDCR, started the FETP program in Bangladesh. It is the first ever 2-year residency course on applied epidemiology in Bangladesh. Fellows get books, laptops, monthly stipend, accommodation facilities, and grants for research. Fellows get opportunities to present at national and international conferences. Fellows spend 20% time in the classroom and 80% time in the field. Government medical doctors, government veterinarians, and doctors of the Army Medical Corps can apply. Successful graduates will be awarded 2 certificates, one from US CDC and one from the university as a master's degree in applied epidemiology. Graduates can be promoted as assistant professor, run public health programs, or lead national, district, and Upazila rapid response teams. FETP B residents and graduates are our boots on the ground in the ongoing battle against public health emergencies. Join FETP B and be a disease detective.
So we are very glad that Bangladesh government started this course in 2013, and this course actually gives the opportunity for the government doctors to be disease detectives and also participate in national public health responses. I just want to mention that, sir, this is a course that is we have affiliated in Dhaka University under the instruction of order from the ministry. So now we are actually taking the opportunity to affiliate the course in Bangabandhu Sheikh Mujib Medical University. So this is a course that is already our medical doctors are getting deputations. And the participants of this course that you saw, sir, they actually worked from the March 8 and they worked in the hotlines, case investigations, and we have a lot of presentations of these fellows. And our director madam will have the presentation, and this presentation will show also the activities of the FETP. For this conference, I would like to thank IEDCR and the USCDC and also Epidemiology Association of Bangladesh to give opportunity to Field Epidemiology Training Program Bangladesh to participate and organize the conference and make it successful. I want to thank all the fellows and graduates to help me to complete the conference. This is a first time experience for us and also in Bangladesh to arrange a conference on the online and offline version. So this experience is successful. I think in the next year we can also arrange this type of conference. Also, the conference is one of the criteria for the Field Epidemiology Training Program that our fellows need to present their activities, and this is one of the deliverables to complete the course. I also want to thank some of the fellows and graduates like Dr. Kaji Ahmed Jaki, Dr. Rabbani, Dr. Qayyum, Dr. Nusrat, Dr. Firdaus, Dr. Noroz, Dr. Rashid, Dr. Sohel, Dr. Farjana, Dr. Salihin, Muhib, Devashish, Farsim, Dr. Tawhid, Jafrin, Shubroto, all the fifth cohort, sixth cohort and seventh cohort. They actually worked day and night to make the program successful. So this is an opportunity for us, and also this is a gateway for us in the next conference. Thank you, and hopefully we'll be successful more in the next years. Thank you.
Now we humbly request the chair of the closing program, Professor Dr. Tahmina Shirin Madam, to give her presentation on IEDCR.
Honorable Chief Guest, Muhammad Ali Noor, Secretary, Medical Education and Family Welfare Division. Honorable Special Guest, Professor Dr. A.H.M. Enayat Hussain. All the distinguished guests and audience online and offline, Assalamu alaikum and good afternoon. Now I will say very briefly about the IEDCR and its activities, role in surveillance, outbreak and researches. So the IEDCR, it stands for Institute of Epidemiology, Disease Control and Research. Actually, it was established in 1976. Then in 2007, it was designated as National Influenza Center. All of us, we know that there are 143 national influenza centers over 113 countries. Bangladesh is one of them. IEDCR is a focal institute for NIC that I already mentioned, National Influenza Center, Global Health Security, One Health Secretariat, National Health Regulation, Foodborne Emergency Response, Global Health Detection Center for US CDC. Actually, we are working in collaboration with different university here, and we have also collaboration with the global organization that you can see on the screen. This is the organogram of IEDCR. We are basically under the Ministry of Health and Family Welfare. These are our departments, and we have 5 laboratories at IEDCR. So if we talk about the IEDCR laboratory facilities, we have BSL-2 facilities there. We have molecular techniques at IEDCR lab, serology, cell culture for virology department. We have microbiology, full-fledged microbiology department where we can identify or we can isolate the different bacterial pathogens, and also with their biochemical and serological characteristics. Other than this, we have genetic lab, which is belong to One Health, and the entomology lab, where we can see the bioefficacy of different insecticides. So this is the snapshot of IEDCR lab. So another thing is that we have another lab at Cox's Bazar Medical College, that is the IEDCR field lab. We all know that in 2017, end of 2017 and 2018, there was a huge outbreak of diphtheria among the FDA, means the Rohingya people. So at that time, actually in Bangladesh, we didn't have any facilities at that time to diagnose the diphtheria. So during that time, we got support. A team from US CDC came to Bangladesh with reagents and logistics for identification and isolation and molecular detection of Corynebacterium diphtheria, that is the causative organism of diphtheria. At that time, IEDCR did the molecular diagnosis of diphtheria as well as bacteriological isolation and sensitivity of Corynebacterium diphtheria. But we felt that it was very difficult to get the sample from the field to the laboratory and get back the report to the individual. So it was a challenge because it took time for the management. So at that time, with the support from WHO, IEDCR established a field lab there, and since then this lab is supported by WHO, and they can identify the diphtheria organism there at Cox's Bazar, and principal of Cox's Bazar Medical College, he also supported us. He gave space to build the laboratory. Until now they are doing the same thing, but one thing is that during the COVID pandemic situation, from the beginning, they didn't get any type of support regarding the equipments from the government, because this lab is well equipped, and since the beginning of the pandemic they are doing the PCR of COVID-19, and still they are doing. And I have already mentioned that IEDCR, One Health Secretariat is established in IEDCR in 2016, and till now it is working at IEDCR. The IEDCR is based on these 4 objectives: the epidemiological surveillance, outbreak investigation and response, training and research. So there are several surveillance that are going on at IEDCR. I don't want to mention all the things. You can see these on the screen. These are the surveillance that is going on IEDCR. One important surveillance, that is the event-based surveillance, where IEDCR monitor both electronic and print media, which 24/7, and we have the hotline numbers here you can see. So through this platform, we get the informal reporting, and when we get any type of information, we verify those information and then start doing the investigations. That is the outbreak investigation and response. And one thing that I would like to mention, that this the first cases of COVID-19 was identified through this event-based surveillance. These are the, here I would like to mention the outbreak investigation response that is conducted by IEDCR. There are 3 tiers of team, that is the National Rapid Response Team, District Rapid Response Team, and Upazila Rapid Response Team. So the outbreak investigation usually go through this process. So the people who are working at IEDCR, they are the member of National Rapid Response Team. With the support from district and Upazila Rapid Response Team, we used to conduct this surveillance. So this is the mechanism how the outbreak response is happening. So IEDCR has the POC, that is Public Health Emergency Operations Center. When there is any outbreak, the POC become activated, and it then conduct this outbreak response through coordination. And if there is any outbreak which is of zoonotic origin, in that case, not only the people from the human health sector move, along with them, the people from the animal health, wildlife, and other sectors, they also move together to respond the outbreak. This is one example of the outbreak investigation in One Health approach. This is an outbreak of Nipah. All of us, we know that Nipah virus infection is a zoonotic disease, and the virus, the bat is the source of this virus, and contaminated raw dead pump syrup is the cause of this outbreak. Consumption of contaminated raw dead pump syrup is the cause of this outbreak, and here you can see the bat roost, which is discovered by the EcoHealth team. Here they are collecting the samples from the bat. So we collected sample from patient, and the people who are working in the wildlife, they are collecting the sample from the bats. So the way we actually respond to outbreak of zoonotic origin. These are the major outbreaks that usually happen in Bangladesh. So these are the frequency of outbreak that used to occur in different years. Here you can see the frequency of outbreak from 2015 till 2021. There are some snapshot of outbreak investigation. Here is the outbreak in dengue outbreak in 2019. This is also the dengue outbreak in 2019. This is the outbreak, chikungunya outbreak in 2017. And if we think about the outbreak, this pandemic situation, this COVID-19 pandemic, actually we have started working since January, when the outbreak was only limited within Wuhan, and well ahead of declaring of pandemic by WHO. So during that time, we sorted the suspected cases, and collected the sample from suspected cases, and our laboratory became activated, and we collected the sample, and we tested the sample since January 2020. And we started daily press briefing since February 2020, and daily press release in the website. We also developed health declaration form when people arrived in Bangladesh from different places, from different places around the world. And within the 3 days of arrival, we used to call them through cell phone, and we also interview them on day 10 and day 14 through interactive voice response. Our hotline was open 24/7, and we started with the 4 hotline numbers, which increased over 75 numbers, and we used to get call to 3,000 to 4,000 phone calls per day, and thus we identify the COVID-19 cases, and we routinely collect the sample from door to door, and when we get any positive case, we go for the contact tracing. And here we can see the IEDCR also involved in the quarantine activities. And when the first flight from Wuhan came to Bangladesh, all the passengers were quarantined, and we tested samples from all passengers and before they went home. And this is the activity that is still going at IEDCR laboratory. And when the outbreak was declared, or the pandemic started, we strengthened our laboratory capacity, and we started testing real-time PCR of COVID-19. At that time, IEDCR was the only laboratory that could deliver the report. Later on, when government feel that it is not enough to combat the disease, then the number of PCR labs increases all over the country. And at that time, IEDCR Virology Lab was also declared as the reference laboratory. So along with the routine activity, IEDCR Virology Lab is engaged in validation of PCR test kit. They are also engaged in quality check of other PCR laboratories across the country, and also involved in the training of the new labs. Now, the research activity that is conducted by IEDCR, there are some researches that is going on COVID-19 COVID-19 related, and one of the research work already published, and one is in pipeline, and other thing is half of the way. These are other research related activities at IEDCR. Now, the Workforce Development and Training Program. Basically, we have three categories of courses. One is the long course, that is FETP B, which is under University of Dhaka and IEDCR with collaboration with USCDC. These courses started from 2013 and still it is running. Regarding the long course, we propose another two courses which is lab related. One is the MD on virology and MD on microbiology. Because for any surveillance, for any outbreak, lab is a essential component along with the public health activities. And IEDCR lab is well equipped, so we think that we will be able to run the post-graduation course at IEDCR. Another one is the intermediate course, that is 9-month course is known as intermediate FETP B, 3 months course that is frontline FETP, and certificate course on the clinical epidemiology. Here the postgraduate students in the clinical subject, they used to get chance in this course, certificate course. And another one is the Distinguished Fellow Program. The manager, the senior people who are in the managerial level, they used to do this Distinguished Fellowship course. Another one is the short-term training. We used to provide training on disease surveillance, outbreak investigation, infection control and prevention. And we also give emphasis on the emerging and re-emerging diseases. And like if there is any outbreak in any part of the world, we used to, or we want to disseminate those things among the healthcare providers in Bangladesh, not only the doctor, in healthcare providers in different levels like doctors, nurses, technologists, health managers, and different tiers of health system in Bangladesh. Along with them, we also train the veterinarian, statistician of Upazila Health Complex. Now, the capacity of IEDCR lab. Actually, I want to explain why we want to establish post-graduation course at IEDCR on laboratory science. So, if we think about the capacity of IEDCR lab, we have the molecular lab where we can do the PCR. It is conventional PCR, real-time PCR. We have sequencing. We can do the capillary sequencing, that is the Sanger sequencing, and also the next generation sequencing. We have serological facilities, cell culture for virus isolation. We have bacteriological facilities for the culture along with the biochemical and serological test. IEDCR is a reference laboratory for AMR, that is antimicrobial resistance, COVID-19, influenza, Nipah virus, and Japanese encephalitis. And the achievement of IEDCR lab, what we did at IEDCR. If we think about the dengue outbreak in 2020, the first dengue cases were identified by IEDCR. The first Nipah case in 2004 was identified by IEDCR in collaboration with ICDDRB and USCDC. IEDCR played a great role during 2019 influenza pandemic. Though this influenza didn't hit that much in Bangladesh, then IEDCR also took part in in the detection of chikungunya virus in 2008 and 2018. And from 2013 to 2019, IEDCR is doing the molecular detection of dengue virus with its serotype. And we could identify why there was a big outbreak during 2019, dengue outbreak in 2019. As because in 2019 there was re-emergence of new serotype which was not existing in Bangladesh since 2002. That's why it created a havoc in 2019. Then H5N1 and H9N2, these are the avian influenza virus, which was also detected in human by IEDCR virology lab. In 2019, we built capacity for detection of MERS coronavirus. All of us, we know that MERS coronavirus, at that time there was an outbreak in Middle East. So we also prepared ourselves for to detect this virus. And 2015, when there was an outbreak of Ebola in Africa, West Africa, at that time we built capacity for detection of the Ebola virus. We also detected first Zika case in Bangladesh. And thus in 8 March 2020, we detected first case of SARS-CoV-2 in Bangladesh. These are some publications, that is, the books and some health education materials. These are published by IEDCR. We got support from different development partners and agencies to develop these messages. These are the communication materials that we developed. Now the way forward. We propose for more human resources for strengthening of the capacity of IEDCR and to establish academic wing for human resource development. This is our new building, and we propose for the academic division and service division, strengthening of laboratory capacity, post-graduation of existing, upgradation of the existing laboratory capacity, and academic courses in laboratory. Workforce development. For the workforce development, we already submitted our human resources for health, for the health service and health education in DGHS. So we also want to extend our collaboration with the development partner like USCDC and others. We also extend our GHSA project, which is supported by USCDC. And we also want to extend our collaboration with other development partners. So this is our proposed organogram here. More than 800 people we want to get at IEDCR, and we propose for those human resources. Thank you, sir. Sir, actually, I explain all these things because you are here with us, so you will be able to understand what is the activities that is going on at IEDCR, and actually as a national institute, IEDCR need to be strengthened, and for the strengthening of IEDCR, we need more human resources. Not only the human resources, the trained human resources. Thank you, sir. Thank you.
Thank you, madam. Now I humbly request our honorable chief guest, Mr. Muhammad Ali Noor, Secretary, Medical Education and Family Welfare Division, Ministry of Health and Family Welfare, Government of the People's Republic of Bangladesh, to give his speech on this closing ceremony of the first Bangladesh Congress on Epidemiology and Public Health 2021. Please, sir is joining in online in Zoom.
And respected all other members, respected guests, participants, and all other audience, Assalamu alaikum. It's my great pleasure to be here as already you have spent a huge time with all the presentation by the young doctors on epidemiology and public health regarding COVID-19, especially mentioning in lockdown. And it is the first Bangladesh Congress on epidemiology and public health, so far I came to know. Then it's another great pleasure for me to be here and to come in contact with all the expert scientists of IEDCR. Thank you very much for inviting me. And first of all, I'd like to show proper respect to the all frontliners. There is doctors, nurses, and technologists who dedicated their lives during the COVID-19 for the sake of the patient of COVID-19. And IEDCR, the name, it was totally unknown to me before joining this ministry. And sometimes we came to know ICDDRB. It is well-known institution. There is a research center, but IEDCR, it is totally, I think, unfamiliar, not familiar to everyone. As a general people, I can say. But after COVID-19, that is last March 2020, after COVID-19 invention, and there is very infection in Bangladesh, IEDCR came out in front of us as holding the steering to manage the COVID-19 patient because it is a new virus and totally unknown to the all scientists, experts all over the world, and that's why everybody's concentration and attention was only on COVID-19 news every day and every moment. And the whole world was suffering, is still suffering, and Bangladesh is not exception, and Bangladesh is also suffering from COVID-19. And still we are fighting against the COVID-19 and with a strong hand. And I could say that we are a bit successful in comparison with some other countries around us. So this is all the credit goes to IEDCR and all the members because every time we saw that the people from IEDCR, they are working with the virus. They are fighting against the virus. They are inspecting. They are going for research. They are doing a lot of things, how to identify the virus, how to manage it, how to control it, how to prevent this type of virus, and which is very dangerous for human being. So far, we came to know that 5 presentations were there. And at the last presentation, I observed a very young doctors, all the young doctors presented on COVID-19, especially regarding on lockdown. And what is the result? They explain it by their presentation, and they showed their graph and some other statistics. Though the research was, there is, I could say not research, that is, it is one type of survey. Survey was in very small areas. There is sample size is very small. It is not big, so representation is not so meaningful. But even that, the result, segmented result is, I think, representative of all other areas that which are published or demonstrated by the presenter. So, and some of the questions asked by some of the experts, I came to know the answers given by the young doctors. I am really happy to know that they are very much expert and going to be expert, and they are very smart enough to give the answers properly. So I am very, very happy with them, and they have suggested in several areas how to control COVID-19 and how to motivate the people, what are the main measures and strategies to be taken by the government and by all other physicians, and they mentioned it, and it's really good. But there should be, in any survey or a research paper, there should be some weak point or limitations that should be mentioned. I don't know whether in other presentation it was mentioned or not, but in the last presentation, I could not find that there was some limitations or there were some weak points for the surveys. But even that, I think all the presentations so far, I can guess the last one, as I have observed, was wonderful and very, very meaningful presentation. Thank you very much for very much to all the young doctors, those who presented. And on other areas, as director, Ms. Tahmina Shirin mentioned his presentation that all the activities of IEDCR, the research work and all other training work and academic work also, there that is organogram, the human resource capacity and their capacity, what they can do and what is the laboratory facilities are there and everything. That there is you are doing a huge work in training, research and some other activities. You are always involved in all those works. And you are during COVID-19, I can remember that many times I requested Ms. Tahmina, before Ms. Tahmina, Flora, that is, her name is, full name I forgot, Jabrina Flora. I asked her to take some sample for COVID sample test. So every time your people came my residence and took the sample and gave the result. So not only me, I think in all over the city, there is Dhaka city, your people were running here and there, and they dedicated their lives to give service to the people. And this is wonderful, and everyone should be very grateful to you all and your people. And I should say the nation should be grateful to you all, because we are successfully handling COVID-19 so far. But recent time, there is only this month, the trend of COVID-19 infection is very going up. And it is unexpected. It was unexpected. But whatever may be the causes, and no, you know that the causes, actual causes where only the people were not very aware of this dangerous side of this COVID-19. That is how to protect ourselves, how to move from here to there. And they were very, very, very ignoring. They were the people of this country were very ignoring about the COVID-19. They thought that after getting the vaccine, they are free. They have no fear of COVID-19, though the experts, especially Dr. Mustaq Hassan is also with you. Many times he said, and like him, other experts also expressed the ideas that it is not the medicine that will cure all on a sudden. You have to cover your face, cover your nose and mouth, so that there is a use mask, so that the virus cannot enter your body. So our people were very much ignorant about it, and they did not show care about it, and ultimate result is very bad for us. And we should be very careful about it. And this time government has taken initiatives and a strong stand. We are taking strong position that so that to save the people from COVID-19, we have to do something very tightly and strongly. And already you have known that all the tourist areas and all other conventional activities are totally stopped and declared stopped, not to do. And the movement is restricted, and every office except the essential services, all the offices startled by the presence of its staffs and officers. So I think all these activities are going on, and this is only with the suggestion from you. And you are the only person, authenticated person, and you are the authority to give that type of suggestion for the physicians to do or follow. And thank you very much for inviting me. And I think under the leadership of our visionary leader, Honorable Prime Minister, and as well as the leader of our Honorable Health Minister, we will be able to tackle all the problem, especially to face COVID-19. And I think and it will be very helpful if you can provide your research knowledge that is which is published already or yet to be published in future. And that knowledge can be taken with care and executed in our activities. And with these few words, and I like to give thanks to you again, and I'm very grateful to you for inviting me, and thank you very much, and hope in future IEDCR will be the model of all scientific activities among all the research institutions, because this is the time, the present time is the crucial time to go on more research and research we should do. And you are doing that job, and the young doctors are very much energetic to involve themselves in research work. And I am very happy to know that they are going to take a higher degree from Bangabandhu Medical University in epidemiology. There is Masters in Epidemiology, MSc in Epidemiology. It is good news. Whenever I came to know that some doctors are interested to have some pressure Bangla jodi boli. It is deputation, right? Deputation. If they want to get deputation for higher study, then I, without thinking anything, I give the consent, because I am always in favor of higher study. I am always in favor of training, higher training and special training. Otherwise, we cannot enrich our institution, research centers, and all our academic that is institutions. So thank you very much. In future, we will we'll work together for the sake of our nation, so that we can live with peace and happiness. Thank you all.
Thank you so much, sir, for your inspiring speech and appreciating the role of IEDCR in the current pandemic situation. Ladies and gentlemen, now we have come to the end of today's closing ceremony. We request the chair of the ceremony, Professor Dr. Tahmina Shirin, to conclude the closing ceremony of the first Bangladesh Congress on Epidemiology and Public Health 2021.
I would like to thank all of you who were with us for two days, yesterday and today. Whole day you spend your time with the presenters who presented here with the panel discussion and all these things. And I wish great success of these the fellows and the young researchers who actually presented their research work, the posters and all these things. I wish your success in life. Thank you all for your patience hearing and stay with us 2 days. Thank you.